Non-opioid or non-narcotic agents. So in order to fully understand that, we need to know what's a narcotic. So narcotics are basically drugs or substances that affect mood or behavior. So for this medication specifically, it's a non-narcotic. The mechanism of action, so it depends on what we're talking about. As we know, this medication treats pain and fever. So for pain, it inhibits prostaglandins, therefore it blocks the peripheral pain impulses. So that's how it helps with pain. When it comes to fever or its antipyretic properties, it has a direct action on the hypothalamus. So remember, the hypothalamus is responsible for temperature regulation, especially during infection, illnesses. That's a normal physiological response. That being said, sometimes it can cause some negative effects. And so that's the reason why we give patients antipyretics. This medication directly acts on the hypothalamus. The therapeutic effect of this medication is decreased pain and decreased body temperature. Indications include mild to moderate pain, osteoarthritis, and fever. Some precautions: definitely we have to be very careful when giving this to somebody with liver impairment, because it can make it worse or it can lead to liver failure. Also, we need to take in consideration certain genetic diseases such as G6PD deficiency. This deficiency is basically a genetic disease, mostly in males, that causes the breakdown of red blood cells prematurely, therefore leading to hemolytic anemia. Again, side effects include liver impairment. Remember that this is metabolized mainly in the liver, nausea, and vomiting. Some nursing actions include assessing for therapeutic effects as well as side effects. And then definitely, since we know that it can affect the liver and cause liver impairment, we want to follow or monitor LFTs or liver function tests. This medication is given both IV and oral. So oftentimes this is given IV in the OR for pain management as well as post-op. This medication is actually quite expensive, so they don't use it often, but when they do, it's usually post-op. And not only in the OR, we see it also being used in the ICU or for somebody who just had heart surgery or open heart surgery. Patient education: we have to educate our patient regarding the correct dose, and also to keep in mind that to take in account the amount of acetaminophen and the other combination drugs such as in Norco, let's say hydrocodone 5-325. So that should be included in the calculation of the total dose within the 24 hours. In addition, we need to know the dosing of Tylenol or acetaminophen. We need to make sure again that we know that the total amount of given alone and in combination drugs. So it needs to be a total of everything. The maximum dose for adults in 24 hours is 3 grams or 2 grams per day for patients with liver disease. So for this class, we have to know that it's 3 grams in general for adults in 24 hours. And the primary organ affected is liver. The antidote for this medication in case of overdose is mucomyst or acetylcysteine, as we learned in previous units. Examples of drugs in this class include Tylenol or Ofirmev or acetaminophen. So Tylenol is the brand name for the oral one, and Ofirmev is the brand name for the IV form of acetaminophen.